Ehlers Danlos Syndrome is a connective tissue disorder that's become more well known lately because of artists like Sia coming public with her diagnosis. I've been very fortunate to be able to help patients with EDS for over 20 years. EDS, or Ehlers Danlos Syndrome, it's a hereditary connective tissue disorder. And essentially, people are held together by collagen. Collagen is one of the most important building blocks of life. And in patients like myself who don't have EDS, my collagen is made very strong and very thick because it's like a wavy type of bond. In patients that have Ehlers Danlos Syndrome, their bonds and their collagen are looser. Now this is very good because it allows these people to have more flexibility, but unfortunately that's at the sake of decreased durability. And we see patients with Ehlers Danlos Syndrome have problems with their joints, usually starting in their 20s, but lately I've seen patients that have been diagnosed with EDS and they didn't realize that they had it until their 50s or 60s. Patients with Ehlers Danlos can exhibit symptoms of pain throughout their body, but usually located in joints. The problem is that when a person with Ehlers Danlos breaks down, they usually break down in multiple areas, not just one area. And it becomes a very painful syndrome for them. And unfortunately, the pain that they experience in these joints can lead to significant debilitation. But fortunately, using regenerative medicine, I've had great experience in helping patients with Ehlers Danlos Syndrome regain their function, restore their joints, and reduce or eliminate their pain. One of my patients was a very famous playwright, and she used to have to travel around the world because of her shows, and her life was really very miserable, and her ability to do her job was severely compromised. It took a little while to treat her, and we had to fix almost every joint in her body, but now she can live a really normal life, travel around the world to promote her play, and restore what she loves to do.